This seminar is sponsored by Neurocare Pro. We here at Neurocare Pro want to thank you for attending our webinar on peripheral neuropathy today. This presentation is not intended to diagnose you and is solely for informational purposes only. Upon conclusion of this presentation, you can continue to visit the Neurocare Pro website at neurocarepro.com for more information on this amazing health segment called photobiomodulation. What are we doing? Revolutionizing the treatment of neuropathy with a technology. Turn off the pain and turning on the relief. What is peripheral neuropathy? Peripheral neuropathy is caused by a failure of your microscopic vascular system, which causes swelling and damage to your microscopic nerve tissue and blood capillaries. And so it begins. Peripheral neuropathy usually starts in the tips of your fingers and/or the tips of your toes, as these are the furthest from the spinal column and the smallest vascular system. Nerve fibers are classified based on their thickness and are classified as small or large fiber, and each of them have a different job. Large fibers send messages to our muscles for movement, and large fiber neuropathy can cause loss of joint positions. They also carry some sensations to the spinal cord and brain, including touch, vibration, and balance. The small fiber neuropathy usually starts in the toes and tips of the fingers and affects sensory nerves, which transmit sensory information disturbance and send signals to the brain, internal or external, like pain, burning heat, cold, or autonomic functions like heart rate, blood pressure, hearing, bladder control, etc. Symptoms. Damage to the sensory nerves causes pain, sensitivity, and numbness. Tingling, prickling, or burning sensations. Problems with positional awareness. Damage to the motor nerve causes muscle weakness, painful cramps, uncontrolled muscle twitching, muscle atrophy, and decreased reflexes. More symptoms. Damage to the autonomic nerve affects non-voluntary bodily impulses, such as heartbeat, bladder control, and blood pressure. Damage to the proximal nerve causes leg, hip, knee, and buttocks pain, weakness in legs, balance problems, and problems with positional awareness. This is a good illustration of demyelination of the myelin sheath. The top picture represents a healthy blanket around the nerve, whereas the bottom represents a damaged blanket. Types within types. Hypo and hyper, acute and chronic, constant and periodic. There are hundreds of causes, including diabetes and prediabetes, idiopathic, autoimmune disease, thyroid conditions, poor circulation, kidney disease, post-surgical, chemotherapy, infections, anemia, and medications, including statin drugs. Common treatments include lifestyle changes, vibration plates, painful shots of a B12 mixture, medications, surgery, photobiomodulation, electrical stimulation, physical therapy, supplements, acupuncture, and hyperbaric oxygen therapy, or HBOT. The dangerous drugs that mask symptoms are Neurontin, gabapentin, and Lyrica. It steals your memory like a thief in the night, weight gain, depression, and reduces your energy levels. What are your choices? You can go to a neurologist with nerve tests and more medications and start the journey of an ineffective treatment, and in many cases add further damage to your body, particularly if you decide to begin taking the meds. Typical treatments include electrical stimulation, physical therapy, painful shots, and medications. So what is the answer? Photobiomodulation, or otherwise known as low-level light therapy. Low-level light therapy. It's space-age technology, scientifically proven, non-invasive, and natural, Doctors and chiropractors recommend it. FDA cleared, safe, and effective. Light therapy. It's non-chemical, non-invasive, no side effects, does not affect pacemakers. It is photobiomodulation therapy. Light therapy for the symptomatic pain or neuropathy. Red and near-infrared photobiomodulation pulsed light medical technology. It's used all over the world by NASA astronauts, submariners, the U.S. military, Department of Defense, Olympic athletes, General Motors, professional sports teams, Harvard, Stanford, MIT, Oxford, and hundreds of other universities. There are thousands of articles on this subject from the National Institute of Health, American Medical Association, Lancet Medical Journal, PubMed, the Mayo Clinic, and WebMD. Photobiomodulation. Light therapy activates nitric oxide, collagen, elastin, and ATP. It's being used by physicians, chiropractors, sports therapists, neurologists, dentists, and veterinarians. And it's used for sports injuries, diabetic lesions, nerve regeneration, heart attack or stroke, Alzheimer's and Parkinson's, and animal applications. Hospitals trust LED lights. Photobiomodulation is so safe that hospitals use it to treat babies with jaundice. Low-level light therapy has been researched by 9,847 PubMed published papers, 1,296 published textbooks, 24 international societies, 18 peer-reviewed journals, and all addressing this new science of photobiomodulation. Photobiomodulation generates nitric oxide, which is called the miracle molecule. It improves circulation via vasodilation, maintains healthy blood pressure levels, combats premature cardiovascular aging, improves sexual function, and supports normal brain cell communication. Nitric oxide was deemed the miracle molecule by 3 researchers who received the prestigious Nobel Prize for the discovery of nitric oxide. Luis J. Ignarro, one of the prize winners, says, "There may be no disease process where this miracle molecule does not have a protective role." Increased circulation. The effects of nitric oxide. Dilates existing blood vessels. Increases formation of new capillaries. Increases nutrient support to all tissues. And increases lymphatic system activity. The illustration on the left represents a normal blood vessel. On the right, it represents a dilated blood vessel. The dilated blood vessel increases the transmission of blood, oxygen, nutrients, and glucose. It also decreases blood pressure and removes cellular waste products. Nitric oxide causes vasodilation, increases blood flow and circulation to nerves and other tissues. Nitric oxide promotes angiogenesis. The picture on the top represents an unhealthy capillary bed, whereas on the bottom, a healthy capillary bed. Question: what does light therapy do? Answer: it increases nitric oxide production, plus it increases ATP production, which equals an increased circulation and pain reduction. The animation you are about to see shows the effects of photobiomodulation in the human body.
A closer look illustrates how the use of light therapy with infrared diodes can help promote the healing process in the body. At the basic level, all cells in the body have a miniature power plant within called the mitochondria. This is where our cell's energy is produced. The technical term for this energy is called adenosine triphosphate, or ATP for short. ATP is formed from oxygen and glucose, both of which are carried to cells by blood flow. Patients with neuropathy often have decreased blood flow, which means all cells, including nerves, are not receiving adequate amounts of oxygen and glucose. Therefore, the mitochondria cannot manufacture normal amounts of ATP. Nerves, most commonly in the extremities, sense this lack of ATP production by sending pain signals to the brain. In some cases, a lack of sensation rather than pain is the chief symptom, and this is the main reason for falls. Because the mitochondria are very sensitive to light, infrared light therapy can stimulate ATP production in the mitochondria. That is, if the nerves receive glucose and oxygen through increased blood flow to the nerves. Light energy stimulates the release of nitric oxide from hemoglobin into the bloodstream. When nitric oxide is released from hemoglobin, it enters the muscle cells in walls of the blood vessels. The muscle cells relax as the blood vessel diameter enlarges, allowing more blood to flow through the vessels. Increasing nitric oxide levels in the body offers a host of benefits. These can include anti-inflammation. Inflammation occurs when oxygen levels are too low, so increasing blood flow via nitric oxide reduces inflammation. Tissue regeneration. Tissues that need to heal require oxygen, nutrients, ATP, and growth factors. Nitric oxide provides an environment for enhanced healing. The key to accomplishing this? Better blood flow. Pain reduction. Pain occurs when oxygen levels at the nerve are too low. Think of how painful your finger becomes if you wrap a rubber band around it. The rubber band cuts off blood flow, thereby depriving nerves and other cells of oxygen. The pain recedes when the rubber band is removed. Increased localized circulation. Nitric oxide is increased locally when light energy is applied to any specific site. Along with it, blood flow increases at the same point. Light is composed of photons. Photons are quantum units of energy. A photon emitted at a specific wavelength or color contains the same energy irrespective of the source. Light near the blue end of the spectrum penetrates about 2 to 3 millimeters. Light at the red end of the spectrum penetrates about 8 to 10 millimeters. And near-infrared light penetrates about 20 to 100 millimeters. Near-infrared light is more energetic than visible light, less resistant to reflection and absorption, and therefore penetrates soft tissue to a deeper level. These are generalizations because the more red cells with hemoglobin in the path of the photons, the shallower the depth of the penetration. Remember, hemoglobin absorbs the near-infrared light energy, thereby releasing nitric oxide. The net result of light therapy is a cascade of beneficial chemical reactions throughout damaged nerve cells that stimulate healing. This response can be directly attributed to increased blood flow. This enhanced, localized blood flow improves tissue oxygenation and therefore plays a role in the following. Improved sensation, which offers better gait and balance when walking. Reduced pain, which can allow for better sleep at night, as well as reduced burning and stinging sensation in the extremities. Increased oxygenation, which acts to reduce inflammation. And finally, increased circulation, which offers the body decreased wound incidences and shorter healing times.
The video you are about to see features Dr. Nathan Bryan, professor of molecular medicine at the University of Austin, Texas. He can further illuminate the benefits of nitric oxide.
Dr. Bryan, you're an expert on nitric oxide. First of all, let's talk about the difference between nitric and nitrous oxide, because they sound a lot alike, but they're completely different, aren't they?
They are, and more times than not, people mistake nitric oxide for nitrous oxide. They're completely different molecules, although similarly, nitric oxide is 1 nitrogen, 1 oxygen. Nitrous oxide is 2 nitrogen, 1 oxygen. And nitrous oxide is actually the anesthetic you get when you go to the dentist office, and it's completely different chemistry and physiology than nitric oxide.
So nitrous is the laughing gas,
Exactly.
with it more commonly referred to.
Right.
Doctor, why does your body need nitric oxide?
Well, it's probably one of the most important molecules your body makes. And it's relatively new in the medical literature. It was discovered back in the early 1980s. It was discovered that this substance produced by your blood vessels actually is nitric oxide gas. So that was in 1987, and then in 1998, the Nobel Prize was awarded to 3 U.S. scientists collectively for their discovery of nitric oxide. So now we know it's the main molecule produced by the cells that line every centimeter and inch of blood vessels. It maintains normal blood pressure. It's a molecule produced by our white blood cells that helps fight off invading bacteria and viruses, and even kills off rapidly dividing cancer cells. And it's a neurotransmitter in the central nervous system. So it's basically involved in every biological system within the body.
Can you touch on a little bit more on how it's made throughout the body? You talked about it's made in the vessels, so it's made in, if you have a vessel there, it's made there. Is that kind of how it works from head to toe?
Well, understanding that it's the endothelial cell, so the single layer of cells that line every blood vessel in our body. So when they're targeted or when they're stimulated to release nitric oxide, the first pathway to be discovered was through this L-arginine pathway. So the endothelial cells take the semi-essential amino acid L-arginine, and through a very complicated, complex, what's basically a 5-electron oxidation reaction, produces nitric oxide. But what we're finding is over time, your endothelial cells become dysfunctional. And that dysfunction manifests itself differently at different ages and people with different risk factors for cardiovascular disease. But really the underlying problem with people with endothelial dysfunction is they're no longer able to make nitric oxide from L-arginine. So a lot of nitric oxide-based products that use L-arginine are ineffective, and in fact they're ineffective because that's really the underlying problem with the patients. They can't convert the L-arginine to nitric oxide. So really the medical community's been searching for 20-25 years on how do you overcome that dysfunction and try to recognize and discover alternative routes for nitric oxide production.
So does that happen with everybody as we age, though? Does production of nitric oxide decrease regardless of the
It
person?
does. It's part of the normal aging process. And in fact, you get about a 10 to 12% decline in nitric oxide production per decade. So really by the time you're about 40 years old, you have 50% of the capacity to generate nitric oxide as you did when you were 18 or 20 years old. And so we think, and we've argued, that really it's that loss of nitric oxide production that allows this fertile groundwork for the development of atherosclerosis, a lot of the diseases that plague people later in life, even Alzheimer's, coronary artery disease, a number of different vascular problems.
Are there certain things that we do that maybe speed up the lack of production ability, I guess?
Sure. So it's really, we think we've made some pretty profound and seminal discoveries in the field, but really when we talk about lifestyle modifications and diets, it's really there's certain diets that will promote nitric oxide production, there's certain diets that will quickly scavenge it and lead to a loss of nitric oxide availability. But yeah, so people with known cardiovascular risk factors, for instance, people with diabetes have less nitric oxide produced than non-diabetics, and in fact, that's what the literature shows is what leads to the cardiovascular complications of diabetics, is that loss of nitric oxide functionality. Sedentary lifestyle, smoking, the common cardiovascular risk factors all point to a stepwise decline in nitric oxide production. And to the contrary, you can eat certain foods that are enriched in nitric oxide activity. You can get moderate physical exercise, which stimulates your endothelial cells to produce nitric oxide. So really diet and exercise, the right diet, the right amount of exercise, will promote and actually prevent, or at least delay, that loss of nitric oxide activity.
Here is a before and after picture of one session with light therapy. The bright areas represent an increase in blood flow. As you can see, this is a substantial increase. Here are some quotes on the subject matter. We believe that the use of NASA light-emitting diodes for light therapy will greatly enhance the natural wound healing process and more quickly return the patient to a pre-injury and illness level of activity. This work is supported and managed through the Defense Advanced Research Projects Agency, or DARPA, and NASA Marshall Space Flight Center, SBIR program. Photobiomodulation by light in the red to near-infrared range, or 630 to 1000 nanometers, using low-energy lasers or light-emitting diode arrays has been shown to accelerate wound healing, improve recovery from ischemic injury in the heart, and attenuate degeneration in the injured optic nerve. Low-level light therapy is being evaluated and introduced in clinical practice for treating both chronic and acute pain, aiding wound healing, decreasing the effects of stroke, and for other applications. The next slides contain graphics of wound healing. Here is an 88-year-old diabetic female treated 3 times a week over 81 days. As you can see, the amputation was avoided. This is another example of wound recovery. Here we have a 40-year-old venous ulcer resolved in 5 months. See how the leg is transforming back to a healthy state. The skin cells are regenerating, steadily closing the wound. and the blood flow stimulated by the pads have aided the tissue to heal itself, all the way to the point where it leaves no scar behind. Here are some other interesting quotes you should be aware of. Dr. Ronald Wyant, a senior scientist at the FDA, says, "Research shows damage from a heart attack or stroke can be reduced by 50% just by putting a powerful light device on the victim's head or chest shortly after the incident." Dr. Weijia Zhao at NASA says that they have been using biostimulation, specifically light technologies, in space missions from 2000. Dr. Fred Kahn, president at Meditech International, says that light therapy does not just manage the pain, but gets rid of it by curing the problem. Dr. and Professor Mike Hamblin at Harvard Medical School says there are two primary types of light therapy: photodynamic therapy, which is the one that kills, such as bacteria, etc., and the other one is low-level light therapy that stimulates healing processes and creates the release of nitric oxide, which helps with the repair of the injury as well. Albert Einstein said, "The future of medicine is a medicine of frequencies." And Nikola Tesla said, "If you want to find the secrets of the universe, think in terms of energy, frequency, and vibration." Warning signs of peripheral neuropathy include pain, tingling, burning feet and toes, cramping restless legs, numb toes, difficulty walking, and balance problems. Act now. Neuropathy is progressive. Symptoms get worse over time. This concludes our Neurocare Pro presentation today on peripheral neuropathy, and we want to thank you for attending. There is likely a doctor with a successful care program for you that will address your peripheral neuropathy. For more information on how Neurocare Pro can help you regain the quality of your life, please contact your doctor and visit our website at neurocarepro.com. Thank you.